Welcome to the e-curriculum on physician health, and this module is entitled Addressing Substance Use Disorders in Physician Colleagues and Ourselves. I think at the outset it's important to emphasize that we are generally a healthy bunch of individuals. We enjoy good health, we eat well, we smoke less than the general population, and in fact we live longer than many other professionals. However, the fact that we have MD after our name doesn't mean that we're immune to the medical problems that our patients face, and in fact when it comes to issues such as mental health issues or depression, that same stigma that exists in society for our patients is probably even magnified for us as physicians. It seems that we have great difficulty getting help and approaching or reaching out for help and assistance when we get into trouble with regards to any substance use disorder issues. In many ways, for me, there's a great parallel between how society looks at addiction and how our profession looks at addiction. Certainly in our city here in Vancouver, it seems to be that when we reach the end stage of this disease, when the individual is homeless on the street, really sick and in fact not far from dying, is when we start to put a lot of money and effort into this disease. We spend very little upstream. And the same thing has existed with physicians and in our ranks for many years, where the emphasis seems to be on how can we detect and confirm that somebody has an impairment with how they're practicing because of addiction. So by impairment I mean an impaired physician would be considered to be one who is impaired in their ability to practice safely. So once again, what we see in our profession is a situation where we wait until we are sure that somebody is impaired, they're just about causing patient harm, and then our strategy has been to report them to the licensing bodies to see can we remove their license or their hospital privileges. And that is really unfortunate because there's so much that can be done. Prior to that, there are so many opportunities that we could avail of. And it is ironic that the impairment that's caused by substance dependence is really so far down the road that it's almost like we have drawn an imaginary line where we assume that a physician on one day is okay to practice and then the very next day they're suddenly impaired. And that just doesn't happen. People have asked me over the years why I would be interested in the whole topic of addiction medicine and why particularly in addiction medicine and the link with physicians. And the reality is that this is a treatable disease. It may not be curable, but it's treatable. There are well-defined elements of a recovery plan that can be put in place whereby colleagues get back to work, they function well, they get their families back, they get their careers back. And quite honestly, we can't afford to discard these people to the scrap heap like we used to before. We need physicians, we need them back at work, and we need to support them. And I am so glad that you're here because this is an important message to get out to people who are watching this curriculum, that for themselves or for a colleague, there's always hope. And in this module, you'll learn some of the ways that you can definitely make a difference in the life of a colleague, or perhaps even in yourself.